For people that are diagnosed and experiencing with cancer, what that feels like on a human level doesn't change while science evolves. And I think at the heart of this project, it is around understanding what it's like for that individual, what matters to them, how we can best support them and meet their individual needs, and often that support as one human to another, and create better relationships and support as a consequence of that.
So for me, the Right by You is patient-centred, and it's to complement all the other services.
Right by You, I think, is about integrated personalised care for the person and their family, working alongside primary care, community and secondary care, and the person and their family. That's the most important, linking it all together. But not about, so it's actually what matters to them, about living with their cancer and within their own lives. So it's not treatment focused, and they're guiding it.
Right by You will look at the patient as a whole.
When you're within the hospital environment, there's a huge amount of care around you, from CNSs to support workers to consultants. So you're always being cared for and supported, and it feels quite a safety net. But what a lot of people have been reporting, when they leave the hospital, which often is a good thing, they've had a curative pathway and they're maybe just under surveillance, they feel quite lost. And all those things are still a problem. People are quite shocked after a cancer diagnosis. People still may have ongoing issues with getting back to work. People might still struggling for money. Those things don't go just because you've left the hospital and the treatment pathway. And also, some people sadly on a palliative pathway, they may finish treatment. They're not ready for hospice care yet, but they sit out there with a whole range of issues that sometimes they don't know where to go to. So it really is bridging between the hospital, GPs, end-of-life care, CMH, everywhere, to try and make sure it's all joined up.
I think it's bringing out the cancer clinical nurse specialist and the support worker out into the community, and seeing patients. The most important bit is seeing patients where they want to be seen, when they want to be seen.
So Right by You is a project that tries to bridge like the medical team with all the other support that a cancer patient actually needs.
So it's given people reflective time to talk. I think it's about creating a service for people rather than people having to fit into a service.
We are working with all stakeholders, but particularly people with lived experience of cancer, to make sure that this is a service that is designed by and works for and fits that local community, that it is responsive to their needs, and it may look slightly different for different populations. For example, the work that we're doing around the homeless healthcare team. And I think naturally with co-design it will continue to evolve and change over time and respond to those needs as we learn and grow as a service.